Hi, everyone. It's Dr. Luciano here with one of my registered nurses, Michelle, and we're excited to join you tonight. I know we're both very passionate about injections in the facial aesthetic field and how we can transform patients. So one of our favorite things to do during the day, and we certainly do a ton of it. So great to have you here and excited to answer all your questions for tonight.
And I'm Michelle. I'm, like Dr. Luciano said, a nurse injector here. I've been here for about 4 years. Lucky enough to learn all of my training through Allergan Medical Institute, the portfolio where Juvederm and Botox Cosmetic all come from. So we're super excited to hear from you all tonight.
All right. We're going to go through some of the questions as they pull up. And I'll have Michelle read them out loud as they come through, and then we'll answer the best we can.
All right. So first question, are treatments painful? Want to take that one?
I would say no. They should not be, especially, when they're done properly with the right technique. Botox, for instance, should be a painless procedure. I know all our nurses have a great technique in here, and when done correctly, a lot of patients don't feel a thing. If anything, it might be a little pinch effect, but treatments are very quick, 30 seconds sometimes, a couple minutes in and out. And most of the time, when it's a new patient coming through with Botox and they get a little bit nervous at the end, they're most of the time say, wow, that was it, know. So, the dermal fillers. So what's your experience with discomfort there?
Yeah, I mean, discomfort is, of course, subjective, but if you are experiencing pain throughout the treatment, that's a good indicator that we need to, repivot and, change our plan a little bit as far as discomfort goes in the treatment. Afterwards, you might experience some tenderness or soreness in the downtime after a dermal filler treatment, but overall, I would say more on the discomfort side, not pain.
And most of these procedures don't require any topical anesthetic. There's lidocaine built into the dermal fillers in the Juvederm product. So after the first pokes, and barely feel much of anything other than pressure. The lips are one of the caveats. We do put some topical lidocaine on, so they're nice and numb before we inject the lips. But very, very tolerable procedures, and discomfort is not common.
So our next question, how do you avoid looking fake or overdone? So I'll start with that one. My goal as a provider and our goal as a practice is, to accentuate, never augment. We want you to leave here feeling like yourself. We don't want to change your look. That's very important to us. Natural and normal results is our goal. So with our, expertise, we're definitely not planning. That's not our goal at the end of the day.
Yeah, we want people to notice that you just look good, not that you've had something done. That's usually the outcome that we're looking for.
What should a patient do to prepare for treatment? Anything to avoid before treatment?
Let's see. Well, I would say if you can avoid taking anything that could thin the blood, that's always a good thing for recovery purposes, not necessarily a contraindication to treatment, but if you could avoid aspirin, unless you're prescribed this as a necessity. Ibuprofen, Motrin, Aleve, those are all blood thinners. Alcohol can thin the blood. So if you have a heavy night of alcohol consumption the night before, that could be a little bit more prone to thinning of the blood. Omega-3s and fish oil can also do that as well. So those are the ones just to be a little bit cautious of, but not something that would prevent us from doing our treatment.
Mm-hmm. All right. So can I treat one area of the face or do everything at once? I think it's all within the treatment plan. We can kind of just establish a timeline and what works best for everybody. You can treat with Botox and fillers in one visit if that's what we've decided as a, patient care plan. But you don't need to. It's a journey. It's not a race. We're going to be here for you every step of the way. So we could do Botox, start with that. We could do dermal fillers 2 weeks as that settles in. And we could do multiple syringes for multiple areas of the face with dermal filler, meaning we could do mid-face and jawline. We could just start with lips, whatever you feel most comfortable with. Again, at your pace, is perfect for us.
Yeah, I agree. I think we both like to come up with a comprehensive treatment plan, and that can be attacked in different stages along the way. So yeah, that's I agree.
Yeah. Next question: how does SkinVive differ from traditional fillers in terms of results?
I'll take that. So SkinVive is a hyaluronic acid like the other dermal fillers. However, it's meant for the skin. It's a hydrator. So it's meant to help with the tone and the texture. You had a good comment about what you call it.
Skin quality.
Cool glass of water.
Oh, it's a cold glass of water for your skin.
Yeah, I like that. So it's a good description.
It's going to give you a beautiful glow, very hydrated treatment. Skin quality is overall a best way to kind of define what we use SkinVive for. And it will soften fine lines and wrinkles, but it's not going to be as impactful as, that other part of the portfolio, like the HA fillers. This is more of a micro droplet version.
Yeah, I think the cheek region as well as the upper lip are two common areas that we like to treat with that. We've also can treat in the neck zone as well. So different areas have really nice results.
What's the difference between the types of Juvederms? So all of the Juvederm products in the portfolio, they're all meant for different areas of the face. The rheology is that they have different densities and G primes and things like that. So their makeup is different. For example, Voluma would be used in the mid-face, Volux to contour the jaw. We can use Volbella in the lips or Ultra in the lips. Other areas, temples, Voluma, and then Ultra Plus for the deeper, more like moderate to severe nasolabial folds. So that is how we choose our products. It's very strategic and thoughtful process as far as that plan. And just as a reminder, you guys will be receiving a text message. Please reply with the code word Botox to be contacted for a consultation. Alrighty, next question. How do you help patients choose the right treatment within their budget?
Well, I think that it's important to first do a comprehensive assessment. And so that comprehensive assessment can include neuromodulators like Botox and dermal fillers, as well as other treatments that may apply, and then kind of go through what would be your recommendation to start first. Typically, if we're doing dermal fillers, it's filling in the mid face, so we start as a nice foundation and build from there. So if there's a budget in mind, you wouldn't start in the lower face and leave the mid face unattended to. So there's ways of acting within the patient's budget to create a nice natural look as we go through the stages. So I think that discussing and listening to your patient and kind of understanding what their goals are, what the budget is, and what you can accomplish in that time frame and that budget is important. So communication is key, and just kind of working with your patient and listening, I think, is a key.
Yeah, definitely agree. Okay. How soon will I see results, and how long do they last? So, Botox versus filler. Botox is going to be, injectable. Again, that's focusing on softening and quieting those hyperdynamic muscles that create fine lines and wrinkles. Botox is going to start to set in about 3 to 5 days and peak in 7 to 14 days. A good treatment will last you about 3 to 4 months. And it's important to note that dose is duration. So a good treatment will last you that 3 to 4 months. So that's important, as you're coming up with your dosing and what's appropriate for you. Dermal fillers, on the other hand, they're a little bit different. So those are hyaluronic acid-based gels. And depending on the filler, they will last a little bit longer, or they will last a lot longer, to be honest. So Voluma, the clinical indication, the clinical studies show that it's going to last for about 2 years. For example, something like a lip filler, Volbella versus Ultra, that can be a 6 to 12 month range, depending on the patient and, particular factors that might metabolize it faster. Do you want to add to anything?
Yeah, I think that's great. And so it's just all about reassessing, So after a treatment, seeing patients back and follow up to see how things settle. In time, as time goes on, things can happen, metabolizing product differently, as well as we age, we lose volume. And, and whatnot. People are losing a lot of weight these days with different weight loss strategies, and that can affect the facial volume. So, most of our patients are coming in. There's frequent touch points and follow-up, whether it's after injection or through the routine Botox. But we always like to do kind of a full face assessment each time you come in, so we can address those areas or at least give some advice what to do going forward.
Okay. So what's the care for Botox? How often do touch-ups need to be done, usually to maintain a natural, smooth look? I think that's a similar, what we just talked about, that 3 to 4 months with a good treatment, we recommend at least rebooking. We can reevaluate, and that's going to maintain that refreshed, rejuvenated look, every 3 to 4 months.
Yeah, agree. And I think that, the first time we treat someone with Botox, it's always that key follow-up, because we don't like to over-treat. So we like to use the perfect amount of units without overdoing it and being a little bit on the cautious side. So just educating patients that, all right, if we need a little bit extra, this is completely normal. And so we'll be able to address that. And each one of us documents precisely what we did at the office visit. So your next treatment will know the exact amount of units going forward, where we place those. So it's really a tailored treatment plan for you going forward. And hopefully knowing that data, then the touch-ups after that aren't going to be as necessary.
Mm-hmm. Do you see the effects of the filler right away? So yes, but the best part is it only gets better. So these are hyaluronic acid based gels, like we've said before. Hyaluronic acid is a naturally occurring molecule in our bodies, and it's hydrophilic. So over time, it's going to, pull water towards it and just really amplify and accentuate the filler that's there. So the results will get better. You will see instantly. So we will take after pictures right after the treatment. Then we'll, 2 to 3 weeks for our follow-up to really see the filler, how it settled.
Yeah, my favorite part of the treatment after fillers is handing the patient a mirror
Yes.
after, and just like the smile. It's just because it's like magic. It does work.
I've had tears
instantly.
like of joy, so it's been really rewarding. Yeah. I love that part. So yes, right away. Do you always need Botox and filler, or will Botox work alone? You can definitely get one versus the other, or both at the same time. I love full face Botox as really kind of a start point, as opposed to just jumping right in if you're not ready. Full face Botox can be very impactful to give you that refreshed, rejuvenated look. All these muscles have their own action. So when we kind of knock those out and give you a lot of lift, anything that's pulling down on the face, that will really give you a lift, refreshed look.
Yeah, I like that strategy very much. And they work completely different. So we're achieving two different things that work kind of in conjunction with each other. So, but I think Botox is a great starting point, but they certainly can be done together at the same visit.
Can you do fillers, Botox, and Easy Gel together?
That's like the trifecta.
Yeah, that would be awesome. It's multimodal, right?
Yeah, so that is possible, absolutely. And so a lot of places and including ourselves can combine the filler with the Easy Gel into a syringe. So they work differently, but they also complement each other. So by giving something that will stimulate your body's own response to building collagen and elastin and those growth factors, along with giving a little bit of volume. So they complement each other well. Botox also does something different, so it'll relax those muscles. So they certainly all can be done at the same visit. There's no contraindication to any of that.
Mm-hmm. Okay. Is Botox the only solution for wrinkles? So it's going to, how do we answer this? It is a multimodal, approach to give you the best outcome. Botox is going to be the neurotoxin or the modality to really soften those hyperdynamic muscle contractions that are creating those lines and wrinkles. There are other factors that can contribute to that. So what I would recommend is make sure you have a great skincare regimen. Modalities like Clear and Brilliant, microneedling, those are going to soften wrinkles as well. We have red light therapy. But yeah, I really think it's not the only solution, but it is, top tier.
Yeah, but for best results, absolutely. It's a comprehensive approach to all that. And just think about what dermal fillers could do. They're lifting and they're tightening, and that can help with wrinkles. The skincare line is extremely important. The Botox also as well, the Easy Gel. These are all things that can help just complement each other. And it's important to address each one. Otherwise, we're doing a disservice for you and not mentioning that.
Okay. Is there downtime after treatment?
So what we typically recommend with injections, Botox and fillers, are no strenuous activity for at least a day. So that means no strenuous workouts, nothing that you're going to sweat profusely. So just kind of taking it easy for the day. Don't lay down for several hours after treatment. And no makeup afterwards. We just don't want to clog those pores, those micro perforations with anything that can contaminate. So extremely important. We just like to keep our areas nice and clean after so they heal up well.
Mm-hmm. All right. Sorry, we're sifting through. These are awesome questions. How much is Botox?
Yeah, so Botox can range. So typical ballpark pricing is usually a couple $100, $200 to $300 per area. So forehead's an area, frown is an area, smile lines. We can go a little bit more significant dosing, a little bit less. So everyone's a little bit different what their requirements are. So depends on how strong those muscles are, what the lines look like, where you're starting out with treatment. So that can be a range between different patients there. Some areas are extremely small, like doing lip flips, or areas around the mouth. So that treatment is less expensive, but that gives you a kind of a range in price.
Alrighty, it looks like we answered pretty much all of the questions, or very similar questions. We want to thank you so much for joining us tonight. What's great about August is right now Healthy Solutions is offering buy 3, get 1 free for our collection of fillers. Is there any other specials that you can think of? It's Juvederm Day on August 20th. So we're super excited about that. We are a top 500 allergen provider, so we are huge proponents for the Alley loyalty reward system. We have a VIP membership, where it's your money to spend, and there's savings on top of that. So we're, super excited to offer you.
Yeah, we also do no interest financing with companies like Cherry and Care Credit. So several ways to help save and manage, payments, and so there is. The next best step, if you're interested in any of this, is just a consultation. They're free and they're very informative. We take our time, but just, educational, and coming up with a treatment plan that can be done in stages, and be happy to meet with you.
All righty. Thank you so much for joining us. We cannot wait to see you for a consultation. We'll talk to you soon.
Good night.
Good night.